Now coming to the relations of the liver, there are two relations, peritoneal relation and visceral relation. The main ligaments attached to the liver are, one, the falciform ligament. The falciform ligament is a sickle-shaped double-layered fold of peritoneum which is reflected from the anterior and superior surface of the liver up to the undersurface of diaphragm and to the anterior abdominal wall up to umbilicus. The two layers of falciform ligament here split to cover the right and left lobes of the liver. The right layer of falciform ligament covers the anterior surface, superior surface, and when it comes towards the upper part of the posterior surface, this is reflected up to the diaphragm. So this reflection of peritoneum here is the superior layer of coronary ligament. The peritoneum also covers the inferior surface. This is the inferior surface here, posterior surface, and in the lower part of posterior surface it is reflected back to the anterior aspect of right kidney to form the inferior layer of coronary ligament. So from below this is inferior layer and from above superior layer of coronary ligament, and these two fuse at the right margin to form the right triangular ligament. The right triangular ligament suspends the right edge of the right lobe to the undersurface of diaphragm. This area between superior layer and the inferior layer of coronary ligament, which is not covered with peritoneum, so this area is known as the bare area of liver. Other bare areas of liver which are not covered with peritoneum are the groove for inferior vena cava and the fossa for gallbladder. Now tracing the left layer of the falciform ligament, the left layer of falciform ligament covers the anterior, superior as well as inferior and posterior surfaces of the left lobe all around, and then it is reflected up to the left dome of diaphragm to form this ligament which is known as the left triangular ligament. So here we can see the left triangular ligament. On the right will be the right triangular ligament. The right triangular ligament has a superior layer and the inferior layer of coronary ligaments. And this is the falciform ligament. After covering the liver, now the peritoneum from the fissure for ligamentum venosum and the margin of porta hepatis is reflected to lesser curvature of stomach and the upper border of the first 2 cm of duodenum. This double-layered peritoneal fold is now known as a lesser omentum. Now coming to the visceral relations. Starting from the posterior surface of the left lobe, this is the esophageal impression which is related with esophagus. The inferior surface of the left lobe has a gastric impression, so this area is related with fundus and body of stomach. The quadrate lobe is related to pylorus of stomach and the first part of duodenum. When the stomach is empty, the quadrate lobe is related to first part of duodenum. After that, this area is related to second part of duodenum. This area on the inferior surface of right lobe is related to hepatic flexure of colon or right colic flexure. Above it, this concave area on the posterior surface of right lobe is related with the right kidney, and above right kidney, this area which is actually the bare area near the lower end of the groove for inferior vena cava, this area is related to the right suprarenal gland. So here will be the right kidney, above it right suprarenal gland. The caudate lobe lies in the superior recess of lesser sac and it is related to the crura of diaphragm above the aortic opening and also to the right inferior phrenic artery and to the celiac trunk. Now coming to the relation on the superior surface, the middle of the superior surface is concave and this is the cardiac impression, whereas on each side the superior surface is related with the diaphragm, right dome and left dome of diaphragm. The diaphragm separates the superior surface above from pericardium and heart in the middle, whereas on each side from the pleura and lungs on each side. The anterior surface is related to xiphisternum and anterior abdominal wall in the median plane, whereas on each side it is related with diaphragm. Again, the diaphragm separates the anterior surface from the pleura above the level of 10th rib and from the lung above the level of 8th rib. The right lateral surface is related with diaphragm, pleura and lungs. In upper one-third of the right surface, the upper one-third of the right surface is related with diaphragm, pleura and lung, that is the right lung. In the middle one-third, the right surface is related only with the diaphragm and costodiaphragmatic recess of pleura, because above this level the lung has already ended. The lower one-third is related with only diaphragm because the costodiaphragmatic recess of pleura ends at this level. So upper one-third related with diaphragm, pleura and lung. Middle one-third is related with diaphragm and costodiaphragmatic recess of pleura, and lower one-third is related only with diaphragm. So these are the important relation of all the surfaces: anterior, superior, right lateral and the posterior-inferior surfaces. The blood supply of liver is by two sources, that is there are two vessels which bring blood towards the liver, out of which 20% of blood reaching the liver is coming from hepatic artery and 80% of the blood is coming from portal vein. The main veins draining blood from the liver is a hepatic vein. There are three groups of hepatic veins, and as we just saw, the hepatic veins, they open directly into the inferior vena cava. So these are the hepatic veins. And then inferior vena cava goes up, passes through the vena caval opening of diaphragm above and enters the right atrium of heart. Now, in addition to the anatomical lobes, the liver is also divided into two physiological or functional lobes, but the plane separating them is different. The plane which separates the right and left physiological or functional lobe is a plane which is passing from cystic notch to the groove for inferior vena cava on the anterior and superior surface. So that is one plane which is joining groove for inferior vena cava to the cystic notch, and from here the plane passes through fossa for gallbladder and the middle of the caudate lobe and back to the upper end of the groove for inferior vena cava. So this plane divides the liver into right and left physiological or functional lobes. So in this classification, half of the caudate lobe is a part of left functional lobe and half of caudate lobe is a part of right functional lobe, whereas the whole quadrate lobe is a part of left functional lobe. Again, the right and left functional lobes are divided into, the right is divided into anterior and posterior segments, whereas the left functional lobe is divided into medial and lateral segments, and each of these four segments further divided into upper and lower parts. So these are the segments, 8 segments of the liver.